Are masks a burden? Should masks be done away with? Is it doing little to prevent transmission since there is no transmission now? Well, almost none. That is an opinion, a controversial one albeit. Is it the time to do away with masks altogether, at least for the time being, and revise the guidelines when things change in terms of an increase in cases? The government of India says no, not wearing masks should not be an option. But some experts believe there has to be a more granular and nuanced strategy.
We know that masks prevent from transmission of the COVID-19 virus or SARS-CoV-2 virus. When the transmission itself is low, what the mask would prevent? So we know that in India, where the number of COVID-19 cases, daily COVID-19 cases are 1 or 2 per million, the benefit of mask is really limited. And then you can optimize the benefit by providing or recommending masks to those populations which are at higher risk. So I reiterate that it is the time India should reconsider the mask-related guidelines. The individuals who are fully vaccinated in the healthy age group, if they are in open space, or rather all population in the open outdoor space, may not need to wear masks at the current low rate of transmission. But if there's a setting where there's a high transmission going on,
mask itself to the community. I'm talking about the large segment of the population who have no interest or knowledge of science. And for them, disappearance of a mask equals the end of the pandemic, unfortunately. And that's the way the common man is going to look at it. They're going to say, okay, the government has said, okay, no more masks, which means the risk is over. So that can translate into extraordinary levels of high-risk behavior. And that can drive transmission.
Some experts say the fact that people are fed up of wearing the mask can't be ignored. Others say relaxing these rules may mislead. Also, many experts and parents say that with the current low level of SARS-CoV-2 transmission and based upon scientific and epidemiological evidence, the face mask mandates or the government recommendations on face masks for children at least between the age of 5 to 12 in India should be removed.
Masks may cut transmission, but they also have costs. So my child didn't go to in-person school for almost 2 years, and now can't see anybody's face or no one can see his smile. It's difficult for special needs kids to learn. It's difficult for young kids to learn emotional skills without looking at facial cues. It's difficult for kids to learn to learn language, and also difficult for them to just make social connections if all of them are masked all the time. Mask mandates in India are not customized to age group or to local COVID transmission level, and this goes completely against global guidance. So, for example, the WHO and the UNICEF say that 5 to 11-year-olds should be masked in certain kinds of indoor settings when COVID is spreading. The European CDC says no masks for under 12s. And right now in India, transmission is low. We know from the past 2 years that children are at very low risk as compared to adults. So I feel that for kids, the mask mandate should now be lifted. It was never meant to be permanent, and so I feel it should be optional now.
Tanya has also initiated a petition unmask our kids and make masks optional in schools. Hence, there are two demands. One is that make masks optional for kids. Let them take it off. Second, come up with a more nuanced policy for masks for everybody. The government for the moment has said no changes. Some countries have relaxed these guidelines, but the World Health Organization is warning against it.
For more informative videos like this, keep watching India Today NewsMo.